Hey, happy Wednesday, everybody. This is Dr. Sean McWilliams, and welcome to another edition of Back Talks, where we create a culture of people that are looking to keep their spines healthy naturally without invasive procedures, without drugs, without surgical intervention. And so, in bringing you, our goal is to be the global leader in bringing you information that you can have, that you know comes from 24 years of wisdom of being in practice, not just stuff that you read on Dr. Google, and showing you the pros of certain things, the cons of certain things, but we want to have a family where people know and places that they can come so they can realize that you can get excellent education and information about your spine and managing spinal conditions and keeping it healthy as well, all from the comfort of your home. Without any further ado, we are doing a series right now, and the series is over the next 4 more weeks, including this week. And this week, last week, we talked about epidural injections. So sticking this fun stuff in your spine. Today, we're going to be talking about doing this again, but we're going to be talking about facet injections and what a facet injection is. So without any further ado, let's do that. So I'm going to bring up everybody here so I can see everyone. And let's see here. I hope everybody's doing great today. Always great to have everybody here. And so what we're going to be talking about today is facet injections and unlocking the truth and understanding the benefits, the risks, and other non-invasive options that you might have to managing spinal pain. So without any further ado, let's talk for a second here. We're going to talk about what is a facet. But before we do that, that's a picture of me with one of my very good friends. And I want to let you know that this isn't just stuff that I read off of Google and create slides for you. That is me getting ready to go in and watch facet injections and being right next to it and seeing the entire process. So I come to you with real wisdom. I feel like, like my friend Dean said, we're drowning in information right now, but we're starving for wisdom. And I want to bring wisdom to you and to your families and your loved ones when it comes to spinal health, so you have a resource that you know is legitimate. It comes from a tremendous amount of wisdom of being in full-time practice and going and doing stuff like this, because I think this is important, is that even though we do natural stuff, I want to know what it's like when someone's on a table, what they go through, what they experience, what's like for them, so that I can share that with you. And so that's what that's all about. So I appreciate you, Doc. So let's talk about what's a facet injection. Well, first thing you got to do is you got to know what a facet is. So let's take a look at that, and we'll do it right here. So what you're looking at right here is you're looking at a close-up of the spinal column, and this is your spinal cord right here. This is your intervertebral disc, which is made up of a couple parts. And if you go back and look at some of our other lives, we talk a lot about discs, so we don't want to get into too much detail about that today. And then you have spinal nerve branches that come off of there. And right here is the facet joint. So it's this piece of the bone and this piece of the bone on both sides. And what that facet joint does for us is it allows our spine to be able to move and glide. So you can kind of see how that happens right there. So there's cartilage in there that you can't see on this model, but that's how it works. And so one of the things you have to know is that when everything works really well, the spine has the ability to glide very smoothly. You can bend and twist, shouldn't cause you any pain. But when they start going wrong, like you start seeing here, and this is a picture of it, is you're going to see this area where that needle's going at. So if you see, this is one part of the facet joint, and that's the other. So there's what's called a superior and inferior articular surface. And this is the cartilage right in here. And if you look really closely, you can see how like rough this looks. So that's an arthritic joint. The official term for that is facet arthrosis. And we're going to talk about how to be able to manage that from at home as well. So you don't have to just do injections, but that's what we talk about when we talk about a facet injection. And so what it's happening there is they're going to be using some sort of numbing agent to put in here, and typically also a steroid, and they're going to inject this through your skin. So let's go look at that. So they're going to be using a needle like you see right here, and I'll show you on the next picture a close-up so you can get a much better idea about it. But one of the things I want people to know is that one of the benefits of facet injections, if you're really struggling with pain and you can't figure it out, is it can determine the difference between these facet generated pain. So if the pain is coming from the facet joint here, or sorry about that, or it's coming from your disc. So if you remember, if you haven't joined us before, or if you have, you'll know that the disc is the #1 generator of pain in the low back, and then the facet joint is #2. So usually about 40 to 45% of low back pain is coming from the facet joint. The rest of it typically comes from the disc. So if you're not sure, what they will usually do is they'll use this facet injection as a diagnostic tool to see if it helps reduce a patient's pain level. If it does, then what they're thinking is, okay, it's facet generated pain at that point. And then typically you're going to be looking at doing an ablation where they're going to go in and kill the nerve. And it's not really necessary all the time. In fact, the majority of the time it's not. We're going to talk about that, but it has its place and purpose. So just keep that in mind. So when we look here, get you right there. There you go. So the way that it works is patient lays on a table, as you can see right here, and they sterilize their back or their neck, wherever they're doing it, and then they're using this machine right here. It's called a video fluoroscopy machine. And what that does is that creates an x-ray image that this doctor's looking at right there on the screen. And then what happens is they're going to use that. They're going to inject the needle through your back or your neck. They're going to start putting it into your body. And then what they do is they take a picture and they look to see what the alignment looks like. And if they need to change the alignment and direction of the needle, they'll know that on the x-ray. They'll move it in a little bit, change it. They'll take another picture, and it says take a picture, push it in a little bit, take a picture, make an adjustment, take a picture, eventually until where they get it into. And here you can see the facet joint right there. And so that's what they're doing at that level, and they're usually going to do multiple levels and see if they're kind of almost take like a shotgun approach and see how you function and if it helps you. So that's the way facet injections work, if you're wondering. And I've sat in on a bunch of those, so I've seen it in person. Are there benefits of facet injections? Well, there are. Just being really honest about this, it can be used as a diagnostic tool. And like we talked about before, is the pain coming from the facet joint? And a majority of the time, if the person doesn't feel it afterwards because they put a numbing agent in there, you're usually thinking that it's probably facet-based pain. If there's no change whatsoever, then usually what they'll do is they'll go and they'll do the facet above the area where they did their initial injection on a different visit, one below that, and then at that point, they're going to look at like a level of 3. If that takes care of your pain or reduces it, then again, they're going to be thinking facet joint. If not, they're going to be thinking the disc. Unfortunately, most facilities don't have really a lot of great options for disc, but we're going to show you, I think, the best option for managing discogenic pain. What else does it do? It can help reduce pain and also reduce swelling, especially if they use some sort of steroid in there. So those are some of the benefits of it. And of course, everything when you just start doing invasive procedures, you're gonna, there's gonna be adverse effects at times. And so the adverse effects can be, you can get an infection from this. If somebody didn't sterilize the back or what they were doing in your body, it can create muscle weakness. You can have allergic reactions. It can aggravate your pain. I've seen that a lot with people. It can damage the nerve if it actually gets injected into the nerve. It can cause bleeding and paresthesia of the nerve. So, there's some side effects. And these aren't cheap. These things are like $2,000 every time that you go to get one. That's a lot of money. These are huge generators for a lot of these clinics. They're done usually for pretty quick, 15 to 30 minutes. You're on and off the table. So, it's big money making things for these clinics. You got to realize this. You got these $25 million plus facilities. Someone's got to pay for it. And this is an easy way. So keep that in mind. If you go to a spine center, this is probably what you're going to be getting. So just realize what you're signing up for. And I want you to see, do you have other options? You do have other options. And I think the best other option, and probably the one that you should always try first in conditions like this, is spinal decompression. When you read the research, it has an 88% success rate. And the amazing part is not only does it work on the disc, but so it can help reduce swelling in the disc, which I'm going to show you in a minute, especially when there's bulging and herniations there, and reduce stenosis, but it can also decompress the facet joint. So when you're doing decompression on there, you can open up. So here you can see arthritic joints. When you're doing spinal decompression, you can open up these facet joints just like that. That's what the machine does. It's amazing. And you don't have to do any surgery. You don't have to do injections to do it. And it's got an 88% success rate when you look at the Mayo Clinic studies, Johns Hopkins, Stanford University studies. So it is always usually my number one go-to that I recommend. And if you stay with us, we're going to be launching our class. I hope that you'll love it. I've spent over the last year of my life taking all my 24 years of wisdom and creating an online course that you can actually do this from your home. You can do spinal decompression from your home. Doesn't matter where you live either. And you have me as your guide. So we're going to be launching that soon. So take a look out for that. So let me show you one other cool thing. I love sharing success stories. And here is a perfect example of one of my patients who came in. What you're looking at over on this left picture is his L5 disc. That's the most common disc to herniate. And you can see this massive disc extrusion. That big black blob is not supposed to be in there, pushing into the spinal canal and the spinal cord. If you go to most surgical centers, you're getting surgery. If that's what your MRI looks like, I want you to know that. They might start with injections and an epidural, but an epidural is not going to fix that at all for you. You have to suck that disc material back in. Then you have to get the disc to be healthy. And this is the same person 12 weeks later. Spinal decompression, no surgery, no drugs, using decompression to help pull the disc material back in and then get the disc to rehydrate itself and start to heal itself. That's what you can do from home. That's why I teach this every single week, is to let people know you have other choices. If you're being told that you have a bulging or herniated disc and you need surgery, please contact me. I want to help you. I want you to be able to realize that you don't have to get it. In fact, I've sent probably 5 people for surgery over the last 25 years. And the crazy part is that almost none of them really got better from it. And if you're not sure, look at Tiger Woods. He's on back surgery number 5, and the guy's still in pain. He's got to drop out of tournaments sometimes because his back's so bad. That's unfortunately what happens when you get into a lot of these medical facilities. And someone's got to tell you that stuff, because I see it all the time when I go to visit these guys. And I had a doctor that I spent 2 months ago, after about 2 hours of being in the surgical center with him, doing facet injections and epidurals. He says, "Do you know anything about that decompression stuff?" And I was like, "Yeah, a little bit." And he's like, "Let me tell you guys, this is how I make my living doing this." He says, "But if this was me," he goes, "I would do spinal decompression before I ever got injected." So that's surgeons telling you that stuff. It's for real. So we want to be that resource for you. And I hope me doing these lives every week help you feel more comfortable and confident that you have ways besides surgery to help your spine either repair itself or stay healthy. So I love and appreciate you. It's always a pleasure having you here on our lives. I'm going to say bye for the week. See you next week. We're going to be talking about another invasive approach, and that's where we start going into spinal fusions. So it's a 5-part series. Last week was epidurals. Today's facet. So we're going to be talking about that stuff over the next couple weeks. So hope you tune in. Thanks so much. I hope you have an incredible day, and it's such a pleasure having you part of our family. See you next week.